Welcome back to CR Arthritis at the CRA, which is Canadian Rheumatology Association, and AHPA, Arthritis Health Professions Association Annual Scientific Meeting. Today I'm joined by a visiting postdoctoral fellow with Arthritis Research Canada, as well as a postdoctoral fellow from the University of Ottawa, who we've had on the program before. This is Dr. Jenny Leese. Hi. Hello, Jenny. And Jenny actually presented, correct me if I'm wrong, 3 posters. 2 of them, which were part of the poster tour, so those are the ones that were specifically selected to be featured. That's incredible. And Jenny, can we start with a little bit about yourself and how what is a visiting, perhaps share with our audience, what is a visiting postdoctoral fellow? And what is a postdoctoral fellow? What is a visiting postdoctoral fellow? And then we'll launch into your research.
Yeah, sure. So I became a postdoctoral fellow last year after completing my PhD at the University of British Columbia. And there I was supervised with Linda Lee, who is a professor and also a senior scientist at Arthritis Research Canada. And I enjoyed my PhD very much with her. And I was looking at how we can support self-management or self-care, which is a term I know is preferred by some people living with arthritis, how we can support that in everyday life. That was what I was looking at during my PhD, and really looking at people's experiences of using wearable technology to track their physical activity. So really enjoyed doing that research there, and with Linda being a senior scientist at Arthritis Research Canada, there was an opportunity to stay. And so when I started my postdoc in the University of Ottawa, it was agreed that I could be remotely supervised from Ottawa and stay as a visiting postdoctoral fellow at Arthritis Research Canada in Vancouver.
I think it's beautiful in many ways that COVID has opened these doors for us. Yes. We've had to adapt to do things remotely and provide these opportunities. So, selfishly, I'm grateful that Jenny is a mentor for myself, so she gets to stay in Vancouver. So, selfishly, I'm very grateful. Jenny, tell us about this project that resulted in many different qualitative research papers, right? So qualitative being where we ask the participants' experience and we get rich data that isn't a number, if I had to explain it. Did I do an okay job?
Great description, yes.
Thank you.
That's
so
right.
what is this big project?
So thinking back to when the COVID-19 was announced back in March 2020, there was a randomized controlled trial study ongoing at Arthritis Research Canada, and the participants that were part of the trial were talking to us about their experiences, the challenges that they were facing, the changes that were going on in their everyday life, and how that was impacting their self-management. So we expanded the focus of the existing research study to hear more about their experiences of self-managing with RA during the pandemic. And the 3 posters that I'm presenting here have really come from that study, those interviews that we did with those participants to learn more about those experiences.
I think what Jenny, the novel part of Jenny's research is not only was she doing what we call qualitative research, so interviews with participants who are part of a randomized control trial, which is simply to say it was a clinical trial where people are asked or put or allotted to kind of groups, right? You're going to try this intervention, you're going to try this intervention. And what had happened is they seized the opportunity when COVID hit to also examine, okay, well, you're doing this self-care program. What is it like doing the self-care program under the restrictions of COVID, right? That's how you've been able to diversify your research even further. So I think it was incredible that you took the opportunities that came along the way.
We pivoted,
yeah,
but that was largely with the encouragement from patient partners that we have as part of our research team.
Wow.
The patient voice is so central to helping us understand what's important to research in the first place, what the research questions should be. And so, as I mentioned, we were hearing from the research participants, we are facing these challenges. So we spoke with the patient partners on the research team, and they gave us the go ahead that this would be a good focus for us to have going forward, and there's lots to learn about these experiences of self-management during the pandemic. Yeah.
Wonderful. So can you, I'll leave it up to you, Jenny, if you want to, give us an overview of all three.
Yeah.
Or if there's just one specific one that you think our audience would benefit the most from, that you want to share what you found.
Yeah, well, as you mentioned, there were 3 posters. So it's in this kind of study, we wanted to identify themes, sort of patterns across the experiences that we were hearing from participants. So maybe I won't go into all 9, just give you a bit of a highlight, and we could always chat more as you like. But yeah, so we were hearing a lot about experiences of the participants when it came to individual decision making around COVID-19 vaccinations and other public health measures like mask wearing, physical distancing. And what really came through, what we identified through our analysis of those experiences, was that decision making, it wasn't free from influence. It was very relational. It was impacted by friends and family. Some participants felt that they were sort of pressured by some to adopt certain public health measures. But they were also, it was relational in the sense that the participants felt there was a sort of a sense of we're all in this together, and wanting to be neighbourly, and out of a kind of a concern for others' welfare and themselves, protecting themselves and protecting others, they were adopting public health measures on the whole. The majority of our participants did choose to have the COVID-19 vaccination when it became available. So yeah, it was very much embedded in their relational settings, their friends, their family, their concern for local community, even all of humanity, people doing that for the greater good. So that was one key sort of finding. There were also findings about experiences of telehealth and in-person consultations, there being benefits and downsides to both.
Yeah.
And generally, participants were welcoming a kind of a flexible approach, even after the pandemic, in that they were hoping to be able to choose, certain, either a telehealth appointment, depending on what the nature of the consultation was going to be, or an in-person consultation. So having that flexibility. And then the other key finding is around how the participants' perceptions of themselves changed, and perceptions, how other people were perceiving them changed. And it kind of speaks to some inequalities, actually, that we saw in terms of the challenges that some people with RA were facing in their self-management that others weren't. So we had one participant, for instance, who was talking about ongoing racism and telling us that because she was Asian, she felt unsafe in public spaces, and this was impacting her physical activity. She wasn't able to walk in the park as she was used to doing because she felt she was Asian prey, and she'd seen on TV acts of violence against Asian people on the increase during the pandemic. So, yeah, I might stop there and see.
Yeah, I think some of these themes are just so salient, and they themselves, like each of these are just so rich, right? Mm-hmm. I'm so fascinated by all of them, but really this last one of perception of self, right? I think even though we're quote unquote out of the pandemic now, measures have been lessened, and we have to realize that it was a life-changing event for the majority of us. And whether we realize that we've changed and our society has changed because we've been here for so long, I feel like we forget, like, oh, right, we never did Zoom meetings. My day wasn't filled with Zoom meetings 3 years ago. right? Like now it's just, oh, what's the next Zoom meeting that I go to? And to reflect on these are so, not only for the patients, but also I think some of these lessons are so valuable for healthcare providers to know, right? To know that patients themselves, their self-perception has changed, right? Whether that's good or bad. Patients want a choice of whether they can use a device or if they can have it in person, right? So I think it's just so many things that it really, like, I love qualitative research because what it does is it sheds light on all the gaps. Instead of like, oh, we found this gap. It's like, no, what qualitative research does is look at all the gaps. So, Jenny, for yourself, is there one of these areas that you're kind of like, oh, this is so interesting. If I had the opportunity, or perhaps you're already pursuing it, I would love to dig a little bit deeper.
Well, I think what I'm really taking away from the participants' experiences is this sort of message that, maybe we're all in the same storm, but we're not all in the same boat, and that there's many, many different experiences and inequalities in how people have experienced challenges and benefits during this time. So it would be nice to explore that further, I think, going forward. We didn't, as part of our sample, part of the participants that we spoke with, we didn't speak to any who lived outside of urban areas. We didn't speak to people who are gender diverse. These sorts of limitations in our sample exist, so it would be nice to see how experiences may or may not be transferable in other populations. And we're actually partnering with some researchers in the UK at the University of Southampton to speak more with people living with RA across the UK to again see if these findings resonate with them and what their experiences has been and how, like I say, how transferable our findings are across different contexts.
And I love the acknowledgement of the limitations of your own work, right? So thank you for that, Jenny. Thank you for your honesty and for your time and your insight.
Oh, thank you, Ellen.
Absolutely. And Anita, do we have any questions?
Yeah, we do. Do you observe similar gaps in healthcare systems or healthcare across the different countries? Because you've looked at stats from so many different countries, and you yourself worked in so many different provinces in Canada, right?
Oh, interesting. Gosh, that's an interesting question. Yeah, I mean, from the participants that we spoke with in BC, they did experience that there was some frustration that they felt when they were engaging with a healthcare system that was in transition. So one participant comes to mind who was talking to me about how, first of all, an in-person appointment was set up, that then was changed to a virtual appointment, and that never went ahead, and the communication wasn't there in time, all of those changes. There was another participant who was talking about having a consultation in the car park outside of a hospital setting. So that was because she herself didn't feel very safe to enter at the time. So I think those kind of disruptions to how people access healthcare settings I've heard about. Others felt very safe with the public health measures in place. That they were, saying my health provider wore a mask, I wore a mask, I had no concerns. So again, it speaks to that variation. And then I guess in the UK, we're analysing some data from the participants I mentioned who live in the UK with RA. So maybe it's a case of watch this space, and we're still comparing. But I can tell you that there have been some accounts of people feeling that they're not able to access healthcare as they once did, and that's leading to some concerns, some anxieties there as well. So So, yeah, I'd say on the whole, the findings are sort of resonating across these different populations, across the different countries that we've spoken with people in. It's interesting. Thank you.
Thank you, Jenny. And with that, we want to thank our audience for joining us. And we hope to see you at the next session, or we encourage you to check out all of the other recordings and videos, as they're all really interesting and very, very different. Thank you, and with that, take care, everyone.